My name is Robert Hawthorn. I'm a consultant gynaecologist. My NHS appointment is the Queen Elizabeth University Hospital, but I've been working in Ross Hall for more years than I care to remember. From a gynaecological perspective, I'm really a general gynaecologist with a special interest in keyhole surgery. That means laparoscopic surgery and hysteroscopic surgery. As far as management of problems are concerned, we're usually talking about management of abnormal menstrual bleeding, be it heavy periods, be it painful periods, bleeding between periods, bleeding after menopause. It's also associated with pain associated with periods, ovarian cysts, particularly, and endometriosis would be a common scenario that I see most people for, endometriosis being my main interest in the NHS. The treatments I offer would be, from an outpatient basis, most treatments are based around medical management in the first instance, trying to manage symptoms without surgery as a second line, which it usually would be. The treatments would usually be hormonal treatments, sometimes non-hormonal treatments if appropriate. But from the surgical perspective, keyhole surgery really offers us a way of managing symptoms in a conservative means, but sometimes that comes down to formal surgery, of which keyhole surgery just affords a quicker recovery, better return to normal activities. And that can take the form of hysterectomy, removal of ovarian cysts, treatment of endometriosis. But in some patients still, open traditional surgery would still be important or relevant, particularly management of really large ovarian cysts or sometimes fibroids that require open surgery rather than keyhole surgery. Some gynecological cancers require open surgery as well, but in essence we try to manage all patients by keyhole surgery if it's at all feasible. From my perspective, mostly would see patients who've had a GP referral, but we certainly see patients who haven't been referred with their GP. Just makes it a little bit easier. The patient pathway would usually involve an initial consultation, some form of investigation, otherwise sometimes an ultrasound scan, sometimes a CT or an MRI. All of the facilities for outpatient investigation are really here at Ross Hall. Some other investigative procedures we sometimes undertake is day case surgery. Sometimes it requires a one-night stay, but that's mostly how it would be arranged. I've been coming to Ross Hall, as I say, for many, many years, and Ross Hall have been pretty progressive as far as the treatments that they've offered and the way that the service has developed. And they've always been facilitatory in terms of equipment, in terms of staff, really from the front door through the diagnostic services to the patient, to the people in theatre, to the nurses in the wards. They've all been really fantastic. And I guess the most recent innovation is just bringing up urogynecology services to something that they didn't have before for investigation of women with urinary incontinence, which is a relatively new development. But in general terms, they've really been supportive and innovative as far as ongoing management is concerned.